Republicans in Congress are moving quickly toward replacement of the Affordable Care Act, otherwise known as Obamacare. Analysts with the Congressional Budget Office say the plan would cut federal spending, but also result in a loss of health insurance for 24 million people. With some thoughts on the possible results in Massachusetts is our guest from Healthcare for All, the Policy and Government Relations Director, Brian Rosman. Thank you very much for being with us,
Thank you.
Brian.
It's so good to be here, Chris.
We had near universal health care even before Obamacare in Massachusetts. So the way this is taking shape now in Washington, what would it mean here?
This would be tremendously damaging for Massachusetts. You're right. We had good coverage before because we pioneered what was, people jokingly called Romney Care before there was Obamacare in 2006, where Republicans and Democrats, business and consumer groups, hospitals, doctors all came together to find a consensus way to improve healthcare coverage that was so successful here. We got an insurance rate from about 10, 12% to about 3, 4%. And when President Obama basically tried the same formula, the substance was the same, but the politics were completely different. And the Republicans, of course, walked away from it, said they were totally opposed. And ever since then, 2010, Obamacare has been a highly partisan issue. And with the election of President Trump, that's what's playing out in Washington.
Well, one of the things that we pioneered was stretching the envelope on Medicaid eligibility.
Right.
So you didn't have to be extremely poor. You could be somewhat poor.
Well, it's not the poorness. It's under the old rules, you had to be poor and something else. It wasn't enough just to be poor. You had to be poor and a parent, poor and a kid, poor and disabled, poor and senior. What Romney pioneered here and what Obamacare does is allow people to get health care through Medicaid, which we call MassHealth in Massachusetts, just if you're just low income, very low income by itself. So those are adults who are not parents, who are not children, who are not seniors, can now get MassHealth. And here we have about 300,000 in that category, and the bill that's moving in Washington would eliminate that coverage altogether.
So in other words, it's the whole category. It's not strictly about how much money you get to stretch around.
Right. So about 300,000 people roughly, starting in 2020, would start losing their coverage, and that category would be eliminated under the bill that's moving.
Now, I guess the Republicans are thinking of other things to help that population. It could be maybe tax credits or medical savings accounts.
Yeah, so the health savings accounts is one of the cruelest parts of the bill from our point of view. It only works if you can save money. The idea is you save money in advance, so then when you get sick, you have a fund to pay for your healthcare needs. That only works if you have money to save. We're talking about very low-income people making $16,000 a year. They're just making it day-to-day as it is. And certainly this health savings accounts idea isn't going to help them.
Well, one of the other conclusions by the Congressional Budget Office is that at least nationally the trend is going to be that insurance would be so costly for people, I guess, between 40 or 50 and 64, that they'll just forego insurance.
Right.
And then that will bring down the price for younger people.
Yeah, it will, ironically. The Republican bill, I got to say, helps exactly the wrong group of people. It makes insurance costs go down for the younger and for the healthier and for the richer, and raises costs for the older and the poor and the sicker. It's just, to my mind, it's the opposite of where we want to go.
Of course, the other thing that's involved here is the emphasis on preventative care. I know that the CBO didn't have to strictly look at that, but
Yeah.
what do you see changing?
There's a $1 billion fund that was set up under the ACA called the Prevention Trust Fund that gets eliminated completely under the Trump bill. And that fund pays in Massachusetts about $17 million we're getting directly. It funds our Department of Public Health activities, particularly vaccines for low-income kids, CDC, which does critical work, making sure preventing outbreaks of disease. So all that money will just evaporate, and we'll be left without the prevention help. And one more thing real quick. Preventing disease is the cheapest way to keep people healthy. It's way cheaper to keep people healthy in the first place than it is to take care of them when they're sick.
This is BNN News, and we're talking with Brian Rosman from Healthcare for All. Of course, the other thing, Brian, is when I think of preventative care, I'm picturing neighborhood health centers, access, culturally appropriate health care. Yeah. Is that going to be much change, you think?
So the community health centers have been the biggest beneficiaries of the expansion of coverage that we've had here. They're going to really get hit hard by the Medicaid money going away and the money through the connector, the help for moderate income people, and that gets reduced dramatically as well. So we really worry about the viability of our community health centers. Massachusetts invented the community health center movement. The first one was here. And they've expanded dramatically in the last decade or so because they provide culturally appropriate, local-based care. People want care in their neighborhood. Boston itself has dozens of these sites, and they're in a lot of danger.
What about the likelihood of employers continuing to sponsor coverage for their workforce?
Well, most large employers offer coverage because it's a benefit of work, and they're able to do that. But for small, medium-sized employers, the ACA provided tax credits to help people offer coverage for low-wage companies. That also gets repealed in the bill. So we fear a decline in employer-sponsored coverage. The CBO found that there would be some decline, and that's what we expect to happen. In Massachusetts, we have a special issue going on right now. Governor Baker has proposed reinstating the old requirement from the Romney Care bill that had been repealed here, requiring employers to provide coverage to the workers, and that's on Beacon Hill debate right now.
Of course, further down the line, and I know it's not part of the current legislation, Republicans and even Trump are talking about the market forces you unleash when you can buy insurance across state lines. I'm trying to imagine some mammoth insurance company going up to Partners Healthcare and saying, take it or leave it.
Yeah, so right now, of course, insurers can sell across state lines. There's nothing stopping them. But the current regulations say you have to live by the rules of the state that you're in. And so, these national companies like Aetna or Cigna, some of them do operate in Massachusetts, but they do have to follow Massachusetts rules. The difference is what the Trump people want to do is not require them to follow the rules of the state that they're in. We did that with credit cards a few years ago, if you remember. If you look at your credit card, it's probably from Delaware or from North Dakota. Those two states kind of won the race to the bottom to have the least amount of regulations, the least amount of consumer protections. So the credit card companies flocked to those states. What I worry would happen here, Massachusetts has a lot of consumer protections. You can appeal a denial of care. There's lots of things you can do. If out-of-state insurers didn't have to follow Massachusetts rules, patients in Massachusetts would really be under the gun and would have no way to resolve problems, and the prices would skyrocket because the out-of-state insurers would sort of skim the market, cherry pick the cheapest, healthiest people, leaving the Massachusetts companies to cover the sicker.
Thank you very much for being with us.
Sure.
From Healthcare for All.
Happy to be here.
From Healthcare for All.
Yep.
Brian Rosman.